On behalf of my co-authors, I'm excited to share the findings from our study, Preschooler Self-Regulation and Subsequent Behavior Problems in the Midst of Caregiver Depression and Chaos. My name is Elise Kowalski, and I was a postdoctoral research fellow at the University of Maryland School of Medicine when this work was conducted. This work was supported by awards from NIDDK, NICHD, USDA AFRI, and the University of Maryland Baltimore Institute for Clinical and Translational Research. Self-regulation, or the ability to manage one's behavior and emotions, is an important predictor of behavior problems and long-term outcomes like social competence and academic achievement. Self-regulation develops rapidly in the preschool years and is supported by routines and interactions with caregivers and peers, which give children an opportunity to observe and practice this skill. In contrast, self-regulation development is hindered by stressors such as poor caregiver mental health and a lack of routines or chaos in the home. While these can hamper the development of self-regulation, we know less about whether self-regulation skills can buffer against their harmful effects in the future. The COVID-19 pandemic provided an opportunity to examine this question as the pandemic disrupted family routines and increased caregiver stress. Using data collected before and during the pandemic, our study had two aims. The first aim was to examine the association of preschoolers' pre-pandemic self-regulation with subsequent behavior problems in the spring and summer of 2020 or early in the pandemic. Our second aim was to assess if that association differed by caregivers' mental health status and the level of household chaos. Participants in this study were 264 caregivers and their children who previously participated in a childcare center-based lifestyle intervention, who re-enrolled in a COVID-19 observational study and had data on the measures of interest. The lifestyle intervention did not target preschooler self-regulation. Our study used 4 caregiver-reported measures, a measure of preschooler self-regulation that was collected pre-pandemic, and a measure of child behavior problems, caregiver depressive symptoms, and household chaos that were collected early in the pandemic. For our analysis, we used linear mixed models to examine the association of preschooler pre-pandemic self-regulation with child behavior problems early in the pandemic. We then further examined if this association was moderated by caregiver depressive symptoms and household chaos. We had 2 main findings. The first was that preschoolers' pre-pandemic self-regulation was negatively associated with behavior problems early in the pandemic. Our second finding was that this association was modified by caregiver depressive symptoms and household chaos. We visualized this interaction under 4 combinations of caregiver depressive symptoms and household chaos. In the figure, you can see that under all conditions, preschoolers who had more self-regulation pre-pandemic displayed fewer behavior problems early in the pandemic. While these slopes are not statistically different from one another, you can see that in the red line, when both caregiver depressive symptoms and household chaos were high, the slope was attenuated, suggesting that the protective capacity of self-regulation was diminished. In summary, we found that greater preschooler self-regulation pre-pandemic was associated with fewer behavior problems in the context of the early COVID-19 pandemic. This finding is consistent with the body of literature outside of the pandemic. We also found that while self-regulation was still protective in the presence of caregiver depressive symptoms and household chaos, the strength of the association was diminished, suggesting that there's a cumulative toll of caregiver and environmental stressors on children's ability to exercise self-regulation. Our findings suggest that co-occurring caregiver depressive symptoms and household chaos may have rendered children's self-regulation less effective against subsequent behavior problems. Future efforts are needed to ensure young children have opportunities to develop self-regulation, such as exposure to routines, nurturing relationships with caregivers and peers, particularly as we emerge from the COVID-19 pandemic when these opportunities may have been limited. We invite you to read our manuscript to learn more about our study and its findings.